Hi Lifesavers, I'm Roz. I'm from Training by Rozz. I'm here to talk to you today about life-saving things that you can do, such as infant CPR, child CPR, adult CPR and using a defib. So let's get started.
Let's have a look at child CPR.
So, what to do if you have a child who is not breathing normally? This is for children up to the age of puberty. Again, you can use your judgment. If your child is just a little bit too big for you to be able to use the one-hand method, you're going to treat them as an adult. Children come in different shapes and sizes, and it's up to you to judge which one is the correct CPR to use. Remember, there is no wrong way to try and save a life. Are you all right? Got a child casualty who's not breathing. Can I get an ambulance and a defib, please?
Let's break that down, shall we? First of all, you're going to check for danger to yourself, others, and your casualty. You're then going to check response by talking to your casualty and patting them gently on the shoulders. If your casualty is not responding, you're going to consider them unconscious. At this point, you're going to check them for breathing. Gently place 2 fingers on the chin and lift the chin away from the throat. Tilt the head back slowly and gently, trying not to put any pressure on the spinal cord. Now you've opened the airway, place your ear and cheek over the mouth and nose and look down towards the chest. Look to see whether the chest is rising and falling. You can use your arm above the chest to gauge whether the chest is rising and falling. However, do not rest your arm on the chest. If your casualty is not breathing, now is the time to get an ambulance and a defib. The sooner you can get these to arrive, the best chance of survival you're giving to your casualty. As your casualty is a child casualty, you're going to begin with 5 initial rescue breaths. Start by placing your hand on the chin as you did when you checked for breathing. 2 fingers to lift the chin away from the throat. Now, pinch the nose so that when you blow into the airway, you are not blowing air back out of the nose. Now, place your mouth around the casualty's mouth, creating a seal. Put 5 initial rescue breaths into your casualty. These should be small, about the size that a child would breathe normally. You're now going to do chest compressions. Place the heel of your hand on the centre of the casualty's chest. You should be able to do compressions on a child with just one hand. These compressions should be up to 1/3 of the depth of the chest. You should do 30 compressions at a rate of 100 to 120 beats per minute. That's the same beat as Staying Alive by the Bee Gees. It's time for rescue breaths again. Lift the chin as you did before. pinch the nose, and this time put 2 rescue breaths into your casualty. Again, these should be about the size that a child would breathe normally. You're now going to continue 30 compressions and 2 breaths until help arrives, somebody takes over, or your casualty becomes conscious. Let's do it all again and see what you can remember.
Are you all right? Got a child casualty who's not breathing. Can I get an ambulance and a defib, please?
In summary, first, you're going to check for danger. Once you've checked for danger, you're going to check for response. If your casualty does not respond, you're going to check for breathing. If your casualty is not breathing, you're going to call for help, ask them to call for an ambulance and bring a defib. Give 5 initial rescue breaths, then give 30 chest compressions. You'll then give 2 rescue breaths. You're going to continue with 30 compressions to 2 breaths until help arrives, someone takes over, or your casualty becomes conscious.
Thank you for taking the time to watch these instructional videos. I do hope that you never have to use them. If you have a youth group looking for free first aid information, please feel free to contact me. I also run First Aid at Work qualifications, National Rescue Awards for swimming teachers and coaches, and many more.